Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. I'll be talking to you in this video on various stages of a knee problem. A knee problem which is called osteoarthritis. What are the different stages of knee osteoarthritis? And understanding these stages can help individuals to recognize the symptoms early and seek appropriate treatment. So let's understand what are the different stages of osteoarthritis. Let's start with the early stage of the knee osteoarthritis. At this point, the cartilage begins to wear away, leading to occasional pain and stiffness, especially after activity or in the morning. Well, let me try to make you understand how a normal looking joint is. This is the normal looking joint. Okay. When I'll show you the other models, you'll better understand. This is the bluish part, this is all the cartilage, and this is what the gap is between the two bones. This is femur, this is tibia. Okay, and in its mildest form, this is stage 1, all right, where you get occasional pain or stiffness, and this is how it looks like. Okay, so experiencing mild pain while walking, that is going to happen. The patients may also notice mild discomfort when walking or climbing stairs, and swelling might be prominent yet, but there can be a sense of joint instability too. Next, let's see. Now this is a picture, this is a model of a moderate osteoarthritis. Okay, this part you can very well appreciate. These are the lesions which are developing in the cartilage. The wearing and tearing of the cartilage is taking place. You can see it very well. Even on the back side also, this is what the picture looks like. Progressing to more severe one, this is how it looks like. Okay, these are all the cartilages damages which will happen, and this bone start digging into this bone, and the nerve endings which are rubbing on each other, that will start producing pain. All right, so this is what happens in different stages. So as knee osteoarthritis progresses to moderate stage, the cartilage loss becomes more significant. There is significant amount of pain, stiffness and swelling becomes more frequent and pronounced. So there can be, you can have a look at these visuals. Well, the mobility is also affected, and the patients may experience difficulty in bending or straightening their knee fully. Pain may occur during or after physical activity and may interfere with the daily tasks. That's very important. Activities of daily living, if they are affected, that means you are entering into a severe stage. So in the severe stage of knee osteoarthritis, there is extensive loss of cartilage resulting in bone-on-bone contact in the joint. And this leads to intense and constant pain even at rest. This is what the scene looks like. This is how it looks like in the severe stage, and the bone is rubbing on each other. So the joint deformity may develop, and the knee may appear swollen and misaligned too. Mobility is greatly impaired and making it challenging to perform even simple movements. Right. So finally, in the end stage of knee osteoarthritis, the joint is severely damaged, causing excruciating pain and significant disability. And this is the stage when the patient might be getting chest pain also. And this is the stage when patient may need total knee replacement. So at this point, the conservative treatment versus operative treatment, there is always juggling going on between. The joint replacement surgery may be considered to improve the mobility and quality of life in the most severe stage, in the last stage, most advanced stage. So that wraps up our overview of the clinical presentations of different stages of knee osteoarthritis. If you are experiencing knee pain or symptoms, don't hesitate to consult with a healthcare professional for this personalized treatment, especially you should consider consulting an orthopedic surgeon for specialized care. Don't forget to subscribe Lok Talks, hit on the bell icon and hit on the like if you liked it. Share it with your friends. Thank you very much. See you in next video.